Pneumonia is an infection of the alveoli in one or both of the lungs. But before we can talk about pneumonia, we have to explain what alveoli is first. Alveoli are tiny air sacs found in the lung where gas exchange between the atmosphere and blood occurs.
Oxygen moves from the lungs to the small blood vessels called capillaries that surround the alveoli through a process called diffusion. This is when substances move from an area of high concentration to an area of low concentration. Oxygen diffuses from the lungs to the capillaries, while carbon dioxide diffuses from the blood cells to the lungs.
Pneumonia is an infection of the alveoli in the lungs. These sacs get inflamed and fill with fluid or pus, which makes it hard for the alveoli to perform their functions and supply oxygen to the human. But what causes pneumonia? Pneumonia is caused by bacteria, viruses, and fungi entering the body and infecting your alveoli. There are four main types of pneumonia: community-acquired, hospital-acquired, healthcare-acquired, and aspirational pneumonia. Community-acquired pneumonia is the most common type of pneumonia. It occurs outside of hospitals or other healthcare facilities. Bacterial pneumonia is the most common type in adults. This type of pneumonia is likely to occur after you've had a cold or the flu. Hospital-acquired pneumonia is a type of bacterial pneumonia that is acquired during a long hospital stay. It can be more serious than other types because the bacteria is more resistant to antibiotics. Healthcare-acquired pneumonia is the same thing, but developed in people who live in long-term care facilities. Aspiration pneumonia occurs when you inhale bacteria through food, drink, or saliva into your lungs. You can be at a greater risk to develop aspiration pneumonia due to strong medication, excessive use of alcohol, or drugs. The most common way of contracting pneumonia is through another person because the disease is highly contagious, as it can spread to others simply by inhaling the airborne droplets of a sneeze or cough of an infected person. You can also develop fungal pneumonia from the environment, but it is not contagious. The signs and symptoms of pneumonia vary depending on the type of germ causing the infection, age, and overall health of the patient. The most common symptoms of pneumonia can include coughing, fever, sweating, and chills, shortness of breath, and chest pain. There are also additional symptoms of pneumonia which can complicate things.